Welcome to Aging Gracefully on Suncoast FYI. Each week we talk to different experts and professionals on a wide range of subjects to give you tips and advice on living a happy and healthier life, no matter what age you may be. This week on Aging Gracefully, we talk to Alicia Couri, Dr. Russell Samson, and Dr. Terri Dees. This week, author Alicia Couri returns to discuss the different signs of aging and how we can combat them. Yes. Okay, yes, it is a combat.
It's a battle.
It is ongoing every day. So, what can we do to stop the noticeable signs of aging?
Well, first of all, we have to notice them, right? So let's start there.
Okay.
So, you know, one of my favorite movies, some of you might know it, but it's Something About Mary. And there's this character, Magda, and she does all the wrong things, right? She smokes, she drinks, she's a sun worshiper. She has the little reflector and she sits out in the sun. Yep. And her skin is leathery and wrinkled. But we love her, right?
Yes, we love her anyway.
But we don't like that in our skin.
No, we don't want to look like that.
Leathery, wrinkled skin. So some of the things that we need, that's what we're going to talk about today. How do we really stop those things from happening? And over the last few weeks, we have been talking about, you know, collagen and your metabolism, those kind of things. But we're going to really focus on skin today.
Okay.
Yes. So what we want to do is, as you age, some of the things you might notice: skin discoloration, wrinkles, hyperpigmentation. You might start getting adult acne. So those are some of the things that you might begin to see happening on your face and
or
your skin in your
spots
face.
Because of the sun.
Oh my goodness, those are really difficult to get rid of or cover up. You'd need to see a dermatologist for age spots.
Okay.
One of the things that's really good to do is exfoliating your skin. Okay. You need to exfoliate, get rid of those dead cells. That also helps build your collagen because it's allowing the cell turnover, allowing it to renew very quickly. Microdermabrasion is really good.
Now, what is that exactly?
It's, well, some of them, there are some that you do at the dermatologist, and there's some that you can do at home. So it's little beads that aren't, they're not rough, they're very rounded, and a lot of times there's a brush that goes along with it, and you can just slough away the dead skin using that brush. Sometimes the brush is manual, sometimes it's actually electronic, and it can start removing those cells, the dead cells.
Now, are we talking about your whole body or your face, or?
Well, you can exfoliate your whole face with a loofah. I mean, your whole body with a loofah. Okay. You know, just every time you shower, use a loofah, and that helps.
It's very stimulating.
It's stimulating. It helps remove those dead cells instead of just washing with soap, because you want to get rid of the dead cells that are on the top layer of your skin, so that you can start moisturizing it and really start renewing that skin.
So the areas that we should focus on, though, obviously are things that are most noticeable to us.
Right.
Like,
you know, the thing
as
is, okay, so sometimes we focus so much on our face that we forget some other areas of the body, like our neck, our chest. You know, this décolleté area is really important, as well as your elbows. Oh my goodness, your elbows can show your age, and your hands
knees.
and your knees. Yes. So, you know, while you're exfoliating and moisturizing, if you're moisturizing your face, bring it all the way down, you know, to your chest. Protect your chest from the sun. You know, when you're moisturizing, moisturize your elbows, moisturize your knees. These are areas that can get neglected and can start showing aging a lot faster than you'd want them to.
It's a good habit. I mean, I do, after I shower, when I get out and I'm still moist, I moisturize my whole body. But I want to ask you, what about moisturizers? There's so many different ones to choose from. What are the best ones that you would recommend for combating skin aging?
Okay. So anti-aging moisturizers, there are a few ingredients, key ingredients you want to look for.
Okay.
You want to look for things that have peptides in them. So peptides are proteins that help build your collagen. You want to look for something that has retinol in it. Retinol is a vitamin A, and retinol helps also rebuild that skin, that elasticity.
And you can find these in moisturizers.
You can find them in moisturizers, yes. Hyaluronic acid, that helps draw moisture into the skin. So you want as much moisture in your skin as possible, especially as you age, because you lose so much moisture, especially as women. As we start losing estrogen, we lose moisture. So you want to use something with hyaluronic acid that actually draws moisture out of the, you know, our environment to help boost and plump that skin.
Okay, so those are the 3 most important things to look for in a moisturizer.
You want to look for those things in your moisturizer. And one of the things you also want to look for, any skincare product, it has to be paraben-free. You want to look for those words, paraben-free.
You don't want wax?
Yeah, not paraffin, paraben.
Thank you.
See, we're laughing out loud. Parabens are known cancer causers, so you don't want that in your skincare, but it's a cheap preservative, and so a lot of companies still use it.
Okay. So
there's another thing, you know, a lot of people like Botox. I haven't done it myself, but what is recommended is the earlier you start with Botox, and I'm not talking about 12 or 13, I'm talking about in your 30s. Yes. You know, when you
have some wrinkles.
When you actually have some wrinkles, yes. Okay. When you start earlier with Botox, it actually has more long-term benefits than if you start, you know, in your 50s or 60s using Botox. So, you know, it's again a maintenance thing.
Well, one of the things I liked, you mentioned last week, and I know you brought it again with you this week, was your
60-second facelift.
60-second facelift.
Exactly.
Now, what does this have in here relative to what you were talking about?
Well, it also has hyaluronic acid, and it has all those great properties in it, but there's also something, a key ingredient in there that works to plump the skin immediately. So it plumps the skin very fast, and it smooths that skin out so that you can, for at least 8 hours, not have the wrinkles or the signs of those like 11 lines that you get between here or the crow's feet around here, even some of the laugh lines and stuff. You can reduce those temporarily, immediately with this, but then when you continue using it, it does help rebuild your collagen.
It builds up.
It helps build up, and then those lines will get, you know, less and less and less. Yes.
And the more natural to be, the better.
Yes.
Okay. Thank you again for my lesson between paraffin
and parabens.
Right.
The B instead of.
Thanks, Alicia.
You're welcome.
Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Returning this week is Dr. Russell Samson to talk about abdominal aortic aneurysms. Hello, doctor.
Hello. Thanks for having me.
My pleasure. I'm glad you're here. This week, aneurysms.
Yes.
Now, we know that there are, I mean, I've heard of aneurysms in the brain, but where else can they take place?
So aneurysms are a weakening in a major artery. A major blood vessel carries oxygenated blood, and they balloon out. So ballooning of an artery is called an aneurysm, and they're prone to happen in the brain, but in other parts of the body. Now, they are different in the brain and in the other parts of the body. So if someone has a brain aneurysm, it doesn't mean they're going to have it anywhere else. Or if someone has an aneurysm somewhere else, doesn't mean they're going to have it in the brain. But there are one specific area which is very common to have, which a lot of people don't know about, and that's a bulging in the main artery as it goes from your heart through your chest, through your abdomen towards your legs. And that artery is called the aorta. And anywhere along that artery can have an aneurysm. It's a big artery. I don't know if this shows up to the viewers, but it's at least as wide as this hole in my finger. That's how big this artery is.
So a silver dollar
It's like a hose pipe. It's like a big hose pipe.
Wow.
So you can imagine if you have one of these things that then bulges out and ultimately it breaks, rapid death is usually what ensues. So you do want to diagnose this before it happens.
And how can you diagnose that?
So when the aneurysm is in the abdomen, we do the same type of test that you do on a pregnant woman to look at the baby. We use an ultrasound, or you can do a CAT scan, which I think most people realize is just a fancy x-ray, and you'll find the aneurysm. The problem with aneurysms is they are completely asymptomatic. In other words, they cause no symptoms, no pain, no discomfort.
Well, that's it. So how do you catch it before it actually occurs?
So if it's in the abdomen, as I said, your medical doctor will always examine you and feel your tummy, and if they feel it, they'll get the test. But sometimes
so there'll be a bulge of
but
some
it can be
sort.
difficult to feel and difficult to see. So even and if you're a little bit heavy or you've got a little bit of a stomach that's developing, you may not be able to feel it. So generally your doctor will, if they think you're at risk, if you're over 60, usually a male, you're a smoker, have high blood pressure, bad diet, coronary disease, then you're at risk, and most doctors will then order this ultrasound. In fact, if you're in the Medicare age group and you're over 65 and you are a male over the age of 65, Medicare will pay for an ultrasound whether you're at risk or not. If you're a woman, unfortunately, they still don't pay for that test, but we are trying to get them to pay for it at this stage.
And because it happens more frequently in men, or?
It happens more frequently in men, and the results of treatment in women are not quite as good. And I think the government is concerned that unnecessary treatment will result in overdiagnosis in women. But women get it just as much, and they're just at risk.
Now, when you say that you're asymptomatic, again, is it just basically taking care of yourself? I mean, how do you can you prevent aneurysms from developing?
You can't. You can't. I mean, you can watch your diet, you can watch your fats, but there's definitely a genetic tendency towards this. So if you have a family history of someone that had an aneurysm, or someone that died, over the age of 55 or 60 for an unknown reason with a sudden death, you should consider that you may be at risk for an aneurysm too. So we generally recommend people who are in their 60s, who you can't really feel what's going on in the abdomen, to get a sound wave test and see what's going on.
So are there different treatments?
There
or
are.
Is it, okay.
So the standard treatment for many years has been a very big operation where we actually open the abdomen under general anesthetic, cut out the aneurysm and replace it with a tube made out of Dacron. And that's about a 6-day hospitalization. With certain risks, obviously a big operation. Over the last 15 to 20 years, we're replacing at least half of these procedures by actually inserting an artificial artery into the aneurysm through a puncture in the groin.
Okay.
So we call that an endograft because we're actually putting a graft, which is an artificial artery, inside the aneurysm. That's why we use the word endo, which means inside.
Okay.
And that's there, the patient comes in the morning and they usually go home the following day.
Okay. Now you mentioned replacing.
Yes.
So people who've had procedures done before, they need to come in and possibly have that taken out and a new...
Well, I think you misinterpreted me, but you came up with a very, very important thing.
Okay.
So we do this replacement of the aneurysm if there is an original aneurysm, either by cutting it out, as I said, or putting this endograft in.
Okay.
When we do the surgical treatment, it's usually extremely long-lasting, and we do follow the patient, but it's not critical. But with this so-called endograft, which is increasingly what we've been doing for the last 20 years, it's absolutely imperative that those people get followed on a regular basis. Because what we're finding out is some of the original grafts that we were using are starting to fail, and the aneurysms are coming back. In fact, the FDA just put out a statement that anybody that's had one of these grafts must be evaluated every 6 months. So if you have people out there now that have had these in place, they've had an endograft put in, please pay attention, go back to see your doctor and make sure you're tested on a regular basis.
Okay. And of course, what can possibly happen if they don't follow it?
Then the aneurysm comes back and they're at risk for a rupture. Now the good thing is we have very easy treatments to treat these potential problems that are happening. So, we can do it without major surgery in most cases, even as an outpatient. But we have to know about it in advance. So these are good treatments. I'm not saying that someone shouldn't have one of these so-called endografts. They are good treatments. But if you have one, make sure you stay with your doctor.
Okay. And follow up?
Follow on a regular basis, at least every 6 months.
Okay, great.
Yeah.
Thank you, Doctor.
Thank you.
And please tell our viewers again where we can go to find out more information about
Vascular Surgeons, our group, veinsанdarteries.com.
Great. Thank you again for being here.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Dr. Terri Dees of Customized Weight Loss returns this season, and today she is here to talk about a new year and a new you. It's so wonderful to see you.
Oh, thank you so much.
And we're going to start with you.
Okay,
we talked
great.
about this already,
Yes,
and you're
we
so
did.
modest about it.
Yep.
But you just had a baby, a little girl,
did.
8 weeks ago.
8 weeks ago. Her name is Tegan.
Yay.
Mm-hmm.
And since then, you have lost
25 pounds. Yay!
So there's a program for new moms, which you've been following, and obviously it works.
Absolutely, and that's part of our customized weight loss approach, is that we can customize it depending on what people have going on with their health and their lives. So obviously what I'm doing at this phase, being a nursing mom, is very different than what we do for someone who's 75 on blood pressure meds, cholesterol, and thyroid drugs.
Sure. So what could someone anticipate then when they come in to visit you for the first time?
Well, one thing that we've always been really committed to is taking a comprehensive health history on people and seeing what's going on with their health, because different things can affect their ability to lose weight. Another important factor is we look at where's their body fat, where's their hydration level, and then what's their goal and their motivation. And when people have a really big why as for why they want to lose weight, those are the people we tend to see the most successful. So some people might want to do it just to get in some clothes, but other people, it's for health reasons or quality of life factors, special events that are coming up, weddings, or things that they want to be at their absolute best with. And we want to know where they're starting from so that we can really just sit down knee to knee, eye to eye, figure out what we can do to help to get them where they need to go in a very healthy way.
Okay. So when they come in and anticipated weight loss, I mean, that's why a lot of people are on other programs and fail because they don't see the weight coming off. How does your program differ from other programs?
Well, we tend to average, our most common age bracket that we usually work with is 65 to 85. We work with people younger down to the teens. Our oldest patient right now is in their 90s. And we really find that getting people to be successful isn't that difficult when you use science instead of just, a lot of people try to just will themselves to not be hungry, you know, and to stop eating, which some people can pull it off, but most people can't.
And they probably still aren't eating the right things.
And they're not eating the right things. So women in our program tend to average weight loss of about a half a pound a day, and men are anywhere from half a pound up to a pound.
I know, men, it's just not fair. They lose weight faster, right?
They do.
God bless them.
Yes.
So we have Cindy here. We're going to see some slides of her now. Can you tell us about Cindy's weight loss and her journey?
We love Cindy. She is a super sweet, great lady. And like a lot of people, she had a health scare and ended up with a serious health condition that then she decided she needed to change her life. She lost some weight on her own, and then she started to struggle. And like what happens to a lot of people, she started gaining weight back. And she put back on about 20 pounds and decided it was time for some professional help. And one of the things that she said to me is she just decided she was worth it and that she wanted to really get the weight off and change her life. She lost 20 pounds in 40 days, went on to lose another 20 pounds, got down 40 pounds. She really struggled with sugar addiction in the past and had developed facial twitches and things that made her really uncomfortable. All those went away once we got the weight off, but I'll tell you the biggest difference is the change in her self-confidence, of how she feels about herself and how she functions in the world.
And just feeling better. I mean, that just helps everything.
Energy and focus and vivacious and all of those factors.
Well, along those lines then, yes, you feel all of these things. Do you have to exercise to kind of help that journey along and keep you energized, or is this all just about eating properly?
That's a great question. And that's what really stops a lot of people is they think, well, I watch The Biggest Loser. I don't have 8 hours a day to work out. I don't even think I could pull off 20 minutes, you know? And what we see is that in fact 80% of your fitness is really based on nutrition. So when we get the nutrition right, people can lose the weight. So we see a lot of people that aren't able to exercise, they still get great results. Yep, but if you can exercise, of course, that's going to help to speed the process along, get your body moving, is going to help with the metabolism. But if you can't, we really can still get great results.
Okay, and you've told us about another success story right in your own office.
Yep, our weight loss coordinator who's with us, she's lost almost 100 pounds herself. You know, so you have two people, myself and her, that both have experienced this firsthand. And then we really focus too on customizing a plan for people. We really look at a four-pronged approach. You know, number one, we got to get your hydration right. And getting the body hydrated, instantly you'll have more energy. We look at removing toxins from the body. We use a very safe, gentle, effective cellular detox. We look then at what do we need to do to get your body back into fat burning. And that's really the customized part. That people have different health conditions, they're on different medications. Our approach is all natural, holistic. We use all whole food, no packaged food, no processed food. And if people are following our protocols, they'll burn as little as 2,000 calories a day, all the way up to 4,000 calories a day. Obviously, if you're heavier, you're going to burn faster. If you're lighter, you're going to burn a little bit slower. But seeing that weight loss come off keeps people extremely motivated to keep moving forward.
So how many people have actually walked through your doors and I'm sure you might know this number. How many pounds have they lost? Have you got like, it
That's
must
a
be
great question.
Thousands of pounds.
Yeah, thousands and thousands of pounds. Because we have people that see us. You know, we have one lady, 76 years old, lost 100 pounds with us. We have people losing the 70s, 80s pounds. Some people come in and they just want to lose 15 pounds. So obviously their plan looks completely different. We have another lady that wanted to only lose about 6 or 7.
Now you have a special offer for our viewers, which you're very generous to do. What is that, Terri?
Well, you know, I think a lot of people come in and see us and they say, I have tried absolutely everything else and don't know if this is the right fit for him. So I want to offer to the viewers an opportunity to come in at no charge, to sit down with us, to see, preview our program, ask any questions they may have, and see if it's a good fit for them. No one is under any obligation to move forward if they don't want to. But we do have a lot of people that decide they're ready to make that change. They take the action step to move forward, and then it just completely can transform their life.
That's amazing. So weight in segments. Let's say, and again, everybody loses weight differently. But can you give people a range, like if they come in and they, like you said, they have 7 to 10 pounds, they're going to lose differently than somebody that has 100 pounds to lose?
And that's why we customize it for everybody. We look at where their metrics are on their levels of health, body fat, hydration level, health factors, and we're able to tell them that if you need to lose this amount of weight, it's going to be this amount of time. If you need to lose more weight, it's going to be this amount of time. This is how we're going to healthfully reintroduce food so you keep the weight off. And we can narrow it down very specifically to timelines for them. As long as they're staying compliant with what we need them to do, people fall within those averages.
Awesome.
Yeah.
Wonderful. Well, thank you for all that excellent information.
Thank you so much.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.